Let's do this. Let's bring in some of the voices and views on health care reform. People with a stake in what the president says tonight and what happens with the legislation. Of course, all of us have a stake in this. On our panel, Dr. Brian Hill, of urology specialist of Atlanta. Brian, good to see you. Thank you for being here.
Thank you for having me.
Kathy McClure, founder of votehealthcare.org, which promotes guaranteed affordable health care. Kathy, good to see you.
Thank you for having me.
And Kristan Hawkins, her son was diagnosed with cystic plans. She is with us from Washington. Kristan, good to see you as well.
Thanks for having me.
Doctor, I'm going to ask you a quick question. I understand my mic is dying a bit, so take your time with the answer to this while I switch out, and then I'll be rude and cut in. What do you want to hear from the president tonight on the critical question of a public option? We're talking about a government health insurance plan.
Well, the thing I want to hear is I actually want to hear ways that we're going to truly improve this healthcare system for our patients. And the problem that I have with the public option is that we say we practice evidence-based medicine. That means that we look at evidence outcomes from research trials to find the best way to treat patients. And we take that research trials and we take that data and we apply that to our treatment options. Well, if you do the same thing to this public option plan, if you look at prior trials where they've tried a public option, it's failed miserably. If you look at Maine, if you look at Massachusetts, if you look at Tennessee, Oregon, Hawaii, all of these are places where they've tried a public option plan.
Gotcha, Brian. You're not in favor of the public option, correct?
It's not working. It hasn't been shown to work. So why are we voting for it? Why are we accepting it? Why are we looking at it?
So what do you want? What do you want? What do you want? What do you want to see here?
So I want to see our patients actually being put first. I think we need to start changing the dialogue. I think we need to start focusing on patient-centered healthcare reform. It doesn't happen by bringing the government in. It doesn't happen by bringing more insurance in. It happens by putting the patients at the center. We need to start freeing up, and we need to start creating more mobility and affordability within our
Brian,
healthcare
forgive me,
system.
but what does that mean practically? We got to write a bill here. We have to write a bill.
Very easy. Actually, let's start doing things that work. Let's actually truly open up interstate commerce. How come I can only buy, and my patients can only buy insurance from Georgia? Why are we not doing it across the United States? Why aren't we changing our tax codes and our tax laws that my company
To do what? To do what? To do what?
I'll tell you, to do this. Why are we allowing our companies to buy health insurance in pre-tax dollars, and our people, when they don't buy it through their companies, have to pay out post-tax dollars for that? That's ridiculous. Let's add some more affordability. I tell people, how great would it be to make this like Geico, where we've got Blue Cross Blue Shield on TV going, I've got the best rates, you come and buy my rates, and then you see Aetna on TV. We've got to start changing this so that it's patient-centered, patient-focused, because we need to fix this system.
All right, let me shut you down for just a moment here. Kristan, let me come to you for a second. You know what? Let me do this, because I know, Kathy, you have a different view of this. Okay. Kathy, what's your view? You heard from Dr. Hill. He says, no, the public option, the way we're discussing it now, it doesn't work. What's your view?
I disagree completely. The public option, as it's presented in the bills, the actual bills that are before Congress, do something quite different from what Dr. Hill is advocating. Basically, the public option, as it's drafted today, would provide an option for small business owners, for people who are out there at sea in the private insurance market. Mm-hmm. It has nothing to do with the whole question of medicine, where you evidence-based medicine. It's Kathy, not based on that at all.
Kathy, let me move your head a little bit, because I mean, look, here's a little bit of your backstory, and Dr. Hill, listen to this as well, and then Kristan as well. You know, look, you're advocating for your two children who have essentially pre-existing conditions and are essentially at sea here, trying to find affordable health care. So pick up your discussion from there, and then I want you both to talk about this as well.
Yes, so the problem with my kids is they're chronically ill. My son has type 1 diabetes, which is a disease that's genetic. It's due to no fault of his own. My daughter has epilepsy because she was hit in the head with a soccer goal. Both of my kids are in their early 20s, and both of them are uninsurable in the state of Georgia because of their, quote, pre-existing conditions. If there were a public option, they would be able to purchase insurance out there that's affordable for them, and it would provide a guaranteed backup for Americans in their shoes.
And let me stop you right there, and let me bring in Kristan, because Kristan, your young son has cystic fibrosis, and
Yes.
you don't believe that a public health system is a backstop at all for you.
No, actually, my husband and I started researching what a public government nationalized healthcare system would mean for people like Gunnar, who have cystic fibrosis. It's a lifelong, very expensive disease, and it will be fatal for him. And what we found that countries that have nationalized healthcare, like Great Britain, we have a lot of rationing going on in the healthcare system. In Ireland, the survival age for somebody with cystic fibrosis is 10 years younger than it is here today.
Now, can I stop you for just a second? You're making an assumption that that's the way that you would see that kind of a system. It would work that way
Sure.
here
Yeah.
in the United. That's the assumption that you're
That's
making.
exactly what's going to happen. Listen to Dr. Zeke Emanuel, the president's trusted advisor on healthcare. He's on the President's Comparative Effectiveness Research Council. Zeke Emanuel has said that doctors take the Hippocratic Oath too seriously, and all these cost-cutting measures that the president's talking about of doing technology and medical records prevention are merely lipstick and are just for show and public relations. And he's advocated a system of rationing, saying that
Gotcha.
people 15 to 40 should get the best care. It's unbelievable.
I'll jump in just to say, because I don't want to run out of time before I get to this last point, that Dr. Hill would probably agree that there is some rationing of care going on right now in the system. All right, but let me move to this. Kristan, you don't want a public option. Dr. Hill, you don't want a public option. What makes private insurers more responsible moving forward? Stops the practice of dropping people who get sick, charging outrageous rates for people with pre-existing conditions, which is what Kathy's point is. What changes the game here for insurers? And I'm going to give you the last word on this, Doctor, maybe.
I have a word, too.
So very easy. So very easy. And I'm going to go actually back to Kathy real quick, because I agree 100%. We've got to fix this healthcare system. We've got to fix the pre-existing clauses, but the public option's not going to do it. Look at Massachusetts. The cost in Massachusetts have gone up 42% since they bought a public option plan in place in 2006.
Yes,
the
but
rest of the
we're not
United States has gone up.
competition.
The rest of the United States has gone up 18% in that time. So if our goal is to bring down costs, we're failing miserably there. So what we need to do is we need to make patients the center and the focus of this.
Stand by for just a second. Stand by. We got breaking news. Stand by. You'll want to hear this. Bring the panel back just enough time to say thank you to Dr. Brian Hill, Kristan Hawkins, and Kathy McClure. Thank you. That was spirited. Appreciate it. Sorry we don't have any more time.
Darn.
And
Thank you.
Darn will have to stand as your final word. All right. Appreciate it. Thank you all.
Thank you.